Hi, I'm Sankey. I'm the founder and clinical director of Community Wellness Company. In my 30 years as an NHS GP, I've experienced the challenges of working within the confines of a traditional medical model which focuses on illness and symptoms and disease. So I've been on a journey of exploration and discovery, learning about what it means to be human, what makes us ill, what makes us well, training in different therapeutic modalities, training as a coach, and understanding the impact of trauma and how to support people to recover. In 2021, I set up the Community Wellness Company as a vehicle to work with people and communities to enhance their health and their well-being. We're here today at our Community Connection programme in Kevin Mower. This programme has been running for 3 years. And look at how busy it is. We're non-stop from when we open the doors at 9:30 till when we finish at 3. We have people coming all day, popping in or staying for the whole day, staying for lunch. It's really quite a wonderful day. Current science estimates that as much as 90% of all human illness has its origins in exposure to overwhelming or chronic stress in childhood. So we use a trauma-informed root cause approach that focuses on the actual needs of people rather than what we as service providers think they need. People report to us that this is what really makes a difference for them. Many of the people that come here have been in the NHS system and been in services for many years, and actually this is something different and it works for people. So the feedback we get is that this is definitely a lifeline for people.
I've been involved with different services since I was a teenager, and I've been on antidepressants since I was 15. I've been through various therapies and I've felt like I've never really improved. I've never really got better. And I've met Karen when I was again at the GP to ask for more medication. And she said, well, we can go down that route, but why don't we try something different? And this was exactly the thing that I needed to help me change my life and give me my power back. The power to take control of my own health and stop feeling so helpless and hopeless. Because there's a lot of hopelessness in the waiting and feeling like there's something wrong when I'm actually quite normal, and that's okay.
At Community Wellness, we create safe, therapeutic community spaces where we provide the conditions and environments that people need to grow and thrive. Our programmes are delivered in community spaces. They're openly accessible to anybody without eligibility criteria or complex referral. We offer a range of activities. It's almost like a buffet. People can drop in. Some people will come and spend the whole day with us, eat cake and drink tea and have lunch with us. Other people might come along for an hour because they want to specifically engage with one of the activities that's on offer that day. It's very holistic. We have some social activities, community connection, where we talk about what's going on in the community. It's very much about bringing the community together. We then have a range of creative therapeutic activities, which includes some art-based activities, which gets you into flow state. And then we move on to some of perhaps the deeper work, which is around mental health support and trauma support. We have something for everyone, really.
So my name's Alison Webb. I'm the business lead for Community Wellness. To give you some idea of how important it is to this community, I've got a couple of examples I want to share with you. We have a lady, 54-year-old professional lady, who has struggled with childhood trauma and also alcohol dependency. She has required hospital admission via the 999 service on a couple of occasions. She's been referred for specialist alcohol dependency support. In total, over the last 6 months, her total care for that period was £15,000 on an NHS services. To what we offer here for the same 6-month period, we could offer a service within a cluster model of £350. We have another example of a 33-year-old gentleman. He was a homeless gentleman, drug and alcohol dependent, multiple visits to GP surgeries, hospital. He was also involved in crime and had a period of incarceration. His total NHS estimate was somewhere in the region of £35,000, and that was failed detox and rehab. Now he has come to us, and in the last 6 months, his cost of care through us has been approximately £350. So you can see the comparison. Now, of the 80 people that have been attending groups since the beginning of our term, which was the beginning of April, of those 80 people, we have not referred any of those people into secondary care. So you can see it's such a key service to offer, individuals, but it also takes so much pressure off our NHS. Now, if you think 80 people that have joined since the beginning of the term, if those 80 people all had an average NHS care requirement of somewhere in the region of £5,000, we're talking about £500,000 worth of care through the NHS, and that's quite a relatively small estimate when I've just given you a couple of examples. Time and time again, the approach is working, and it's a relatively low-cost option compared with the costs of providing similar services in the NHS.
My name's John, and I'm a community navigator at Community Wellness. I met Karen in 2022, having struggled with my mental health for a long time. I was alcohol dependent and I was drinking myself to death. Karen was running a session at the night shelter where I was living, and she asked me if I wanted a conversation. So we sat down and she asked me one question which will stay with me for the rest of my life, and that is, what matters to me? I'd never been asked that before, and I'd never thought about that question. I'd gone through sort of drug and alcohol services and nothing really worked for me. Medication didn't work for me. With Karen's help and Community Wellness's help, I was able to find out exactly who I was and where I was at. Community Wellness has given me my life back. It saved me. It needs to be far and wide. It saved my life. It saved my life. If enough people are aware of this, it's going to save other lives.
This is why it's so important that we keep the funding of the Community Wellness programme. I'm sure you can see how we want to get this message out, how one, it's supporting a community, but also the cost difference in us providing our service is so substantial.
We really believe that every person, regardless of their circumstances, has the ability, with the right support, to become an active participant in their own health and well-being and healing.